Hello, this is Dr. Umberto Campia from Brigham and Women's Hospital. I'm a cardiologist and vascular medicine specialist, and I'm also assistant professor in medicine at Harvard Medical School. Today we're going to talk about peripheral arterial disease, which is a manifestation of atherosclerosis that involves particularly the vessels that feed our extremities, most commonly the lower extremities. Peripheral arterial disease is a common disease, and if we consider patients who are in their 60s and 70s, up to 20% may present with peripheral arterial disease. And peripheral arterial disease is associated oftentimes with symptoms that can be disabling, life-limiting, but in association with symptoms, peripheral arterial disease may also increase the risk of having deadly complications such as heart attacks or strokes. That's why recognition of the presence of peripheral arterial disease is a very important aspect of the management of every patient who may have an increased risk for the occurrence of atherosclerosis. What are these risks that may lead to the formation of cholesterol plaques that obstruct blood flow to the limbs? The main risk factors are aging, which unfortunately is not something that we can do much about. The second is diabetes, and diabetes is now becoming a very common disease due to the obesity epidemic that has been going on in the US in the last 2 decades. And diabetes increases the risk of peripheral artery disease and also the risk of complications from it, particularly amputation. The other major risk factor is smoking, and smoking, unfortunately, despite the aggressive campaign that have reduced the prevalence of smoking among our population, still represents a major risk factor. The other risk factors are high cholesterol and high blood pressure. Another common disease that is associated with the occurrence of peripheral artery disease is chronic kidney disease, particularly when patients have lost their kidney functions and are on hemodialysis. Now, what are the symptoms of peripheral artery disease? The most common symptom is the occurrence of pain in the calves or the thighs or sometimes the buttocks when the patient is walking. This pain occurs at variable times after the patient starts, and the shorter the time, usually the more severe the blockages are. The pain tends to get worse the more the patient walks, and then tends to go away pretty quickly after the patient stops. So this is called also the window shopper's disease. So it's typical that patients walk for a little bit and then they stop to wash windows. And it's not just because they may be seeing very interesting items, but also because they may getting relief from their pain. How do we treat the patients who have peripheral artery disease? Until recently, we did really not have many effective treatments besides smoking cessation, which is still one of the most important aspects, and decrease of cholesterol and treatment of diabetes and hypertension. Luckily, in the last few years, we have had new agents that have been introduced that can decrease the risk of developing heart attacks and strokes, and also the risk of developing damage to the limbs that lead to amputation. One very effective form of treatment that reduces both the symptoms, so the pain when walking, and the risk of heart attacks and strokes, is the exercise program. And usually this program is 3 times a week and lasts up to 12 weeks, and this is done in appropriate centers that are equipped and that have trained personnel to do it. Peripheral artery disease is a disease that can be treated, is a disease that deserves more attention and deserves particularly by the non-cardiovascular expert more consideration, because it is associated with severe disability and also with high risk of heart attacks and strokes. Signing off for Clot Chronicles, this was Umberto Campia. Goodbye.